Well, you did help out.
Okay, well, Christina, if you wouldn't mind, that would be very much appreciated. And I've got all my supplies here.
Okay.
I bet I'm going to start out just like I did with the other three.
You got it, sister. We're going to review the physician's orders for the prescribed procedure. Compare the S-bar/Cardex with physician's orders for IV venipuncture. Gather equipment and supplies necessary for performing venipuncture. Your IV start kit, IV catheter, extension set tubing, 10 ml pre-filled syringe of 0.9 normal saline, and disposable towel. Check all the venipuncture supplies for package integrity and expiration date.
So I'm starting out like I did in some previous performance evaluations. I've got my S-bar, and I've got an order to start a peripheral line with a 22 gauge. This is exactly what you've got in your kit, the blue package, protective IV, 22 gauge. And I'm going to look at my chart and compare the front of my chart with my S-bar. They match. Catherine Hudson, allergy to penicillin. And I'm going to turn over to my doctor's orders. And I have an order to start a peripheral line with a 22 gauge. And looks like the patient needs to get some IV fluid. The doctor wants me to start an IV so that I can hang a 1,000 ml bag of normal saline to hydrate the patient. Now, you're not going to have to hang the bag. All that we're going to have you do is do the venipuncture and get the line established. But the fluid is on there. Looks like the patient might be dehydrated, and I need that information to do my patient teaching. For my supplies, I've got a drape, because sometimes when we don't work quickly, sometimes there's some drops of blood that escape, and I don't want to create more work for myself getting blood on the bed. I've got a protective IV, 22 gauge, and as Christina said, I'm going to look and make sure that it's in date, September 2018, and it hasn't been opened. I've got an IV start kit with ChloraPrep, and it's also in date, August of 2018, and we'll pretend that it hasn't been opened. I've got a little set of IV tubing here that I'm going to need to make the little tail on it to access it. It's sterile, and it has not been opened. And I've also got normal saline, a 10 ml syringe, just like we took out of your nurse pack and looked at it in the classroom. And I'm turning it, and it's also within date. My clear dressing is in my package. I need to get a pair of clean gloves for my universal precaution. It's not going to save me if I have a needle stick, but if some blood leaks out, then this will help me there. Do I need sterile gloves? Here's a pack of sterile gloves laying up here on the counter. Do I need sterile gloves? No. I need clean gloves. Part of this procedure will be sterile with the over-the-needle catheter, but I don't need sterile gloves. Maybe somebody put those up there to get me off track here.
Okay, you're going to go to the patient's room, cleanse the working surface with a germicidal wipe, and allow it to dry before preparing equipment. Verbalize hand hygiene, identify yourself, and identify the patient with 2 identifiers compared to S-bar.
I'm going to have to put some things down before I can knock on the door. Sometimes I miss the trays that we used to have back in the day to pile things on. Knock, knock. Miss Hudson, I'll be with you in just a moment. I've closed the door, pulled the curtains, sanitized my hands. I need to wipe my table off and let it dry. Am I ready to identify and do some teaching?
You're going to identify yourself with your name, your title in school, identify the patient with 2 identifiers, and visually check the ID band while having the patient verbalize. Compare identification band with the S-bar.
Okay, so while my table's drying, Miss Hudson, my name is Laurel Kendrick, and I'm a student nurse at TCC. I need to, first of all, have you identify yourself, and she verbalizes her name, Catherine Hudson, Date of birth, October 25th, 1984. Does anyone know Catherine Hudson's, this is actually Katy Perry.
Yeah.
It's not Kate Hudson. That's what I thought when I first came to Skills, but it's Katy Perry. And I see that you have an allergy to penicillin, and she says yes. I'm not here today to give you some penicillin, but I do need to know, are you allergic to tape, adhesive, or antiseptic like ChloroPrep? I don't need to ask about lubricant because I'm not going to use lubricant. And she says, no, I'm not allergic to ChloroPrep or any of those things. Why are you asking me that? The doctor has ordered for me to start an IV on you. You came into the hospital with abdominal pain and nausea and vomiting, and the doctor also ordered some IV fluid for you. I suspect the doctor thinks you're dehydrated, and we need to get an IV established so you can get some fluid to rehydrate you. And she said, well, I have been vomiting for a couple of days and I haven't been able to keep anything down. I got so sick when I was out on tour, and now here I am. Yes, I might be dehydrated. So that would be some of my patient teaching. And what I'm going to do, I'm going to look in your, are you left or right-handed? And she said, I'm right-handed. Only 10% of the population's left-handed. I'm right-handed. I'm going to look in your right hand to see if I can find a site, find a place to put the IV, but I can't promise you. I may have to go over to your right side if I can't find anything in your left arm. And I'm going to insert, I have to use a needle, it's a little stylet, but there's a plastic or Teflon sheath. I'll pull the needle out and slide the plastic piece in, and that's what'll stay in your hand, so that we can hook you up to some IV fluid.
That just said, inform the patient about what, why, and how. Teach the patient about venipuncture and what to expect. Ask the patient about previous or perceived experiences. Inform the patient that the catheter insertion or stick may be uncomfortable. And the procedure is performed by using aseptic technique.
Okay, I'm going to put on some gloves, and I've sanitized my hands. I'll probably sanitize them again before I put my gloves on. And there will be a little bee sting, just like when you get blood drawn at the doctor's office when the needle first enters the vein. But once I get the catheter threaded off and get it taped, I'll take the needle out. So the pain should stop at that point. But there will be a sensation like when you get your blood drawn when the needle enters the vein, and I'll warn you before I do that. And I'm going to use the septic technique. I'm going to clean the top of your hand or arm where I find a suitable vein. I could do the rest of my teaching right now, or I could wait until I get my IV established.
Yeah, this is all teaching. It says if IV fluids are being initiated, tell the patient to call for help. If pain, redness, or swelling, warmth develops, call the nurse. Then it says open the IV start kit, remove the tourniquet and the ChloroPrep solution.
Okay, I'm going to put a little, I'll just go ahead and do some of the teaching now. When I get your IV established, I'm going to put a clear dressing on top, and you'll be able to see through. It's like cellophane or the plastic wrap you put over food. And if you notice that there's redness that you can see, or if blood is leaking out, or if it's leaking moisture, I want you to put your hand on the call light and call one of us in. If I'm not working that day, someone else will take care of it. Or if you notice your hand beginning to swell and your fingers feel tight in your left hand, that could be a sign that the IV the vein is slipped out of the vein, and I want you to call for help and call for the nurse to check it. When you're hooked up to the IV fluid, you'll be on a pump also, and you'll need to call for help when you get out of the bed. I don't want you to disturb the IV pump or change the settings. And if it begins to be very painful, you'll feel pain when I first put it in, but if it starts hurting afterwards, then you need to call on the call bell, because that's a sign that there might be a problem with it. And she says, yes, I understand. I had an IV once before, and I remember some of that information.
Okay, I'm going to raise the bed. Okay. Raise the bed to an appropriate working height. Put side rail down on working side. Place disposable drape under the arm and apply tourniquet around the arm. 4 to 6 inches above the proposed insertion site.
Okay, a lot of times in clinical, I pull up a chair and start my IV sitting in a chair, but I'm going to do this standing up, since that's what our standards here at TCC. Okay, I think everything should have dried by now, so I'm going to go ahead and get things set up. I need to put my drape underneath her arm. Do I need to have my gloves on to put the drape? No, I haven't done anything yet. If the skin's intact, and I'm just going to raise this arm up out of the way so I'll have a little more room. We can also do that in the performance evaluation. Go ahead and take the blanket down a little bit and make a work area. It's like she's calling for a cab, but we'll put the, Miss Hudson, I'm putting a little waterproof pad underneath your arm just to keep the sheets clean. I'm going to move that out of the way and open up my IV start kit.
Okay. Palpate the patient. Oh, this says apply the tourniquet 4 to 6 inches above the proposed site. Palpate the patient's radial pulse to assure that the tourniquet is not too tight.
Okay, I think I'm going to use this vein up above her wrist, and I'm going to put the tourniquet on 4 to 6 inches. And right now I'm just on a fact-finding mission, shall we say. So Miss Hudson, I put the tourniquet on your arm. It may feel a little snug. I'm not going to put the needle in you right now. I'm just looking for a vein. And it looks like there's one here above your wrist, and I'm feeling of it. I don't need to put my gloves on because the skin is intact right now. I'm just looking and checking. And it feels bouncy and resilient, so I think it will be a good vein.
Okay. Assess, palpate the radial pulse to ensure the tourniquet is not too tight. Assess the patient's venous structure.
Feel the pulse.
And select the vein for insertion. Use the most distal site in the patient's non-dominant arm if possible. Assess skin integrity over potential IV venipuncture site. Avoid areas that are painful, bruised, inflamed, swollen, scarred, have impaired skin integrity, skin conditions, or infection.
So I'm going to verbalize to my evaluator. There's not any, the vein doesn't feel scarred or hardened. I don't see any tattoos over that vein. It's not red or inflamed. And when I lightly palpated it, she didn't complain of pain. So I think it's going to be a suitable vein. And I've got the tourniquet on with the tails up in the air. I'm going to clean in just a minute, but I'm going to take the tourniquet off. I don't want to leave the tourniquet on too long. Sometimes that causes the veins to bulge too much, and then the vein will rupture. So I think I found my vein, so I'm going to go ahead and release that tourniquet for now.
Okay. Yeah, with index finger, palpate the vein by pressing downward and noting a resilient, soft, bouncy feeling. Avoid areas that have already been compromised by previous IV insertions. Avoid the inner wrist.
So I'm above the wrist, and I said the vein felt bouncy and resilient. It didn't feel hardened or sclerosed. There was no redness or tattoos or anything that would interfere with me using that site.
And then not a site that will interfere with the patient's ADLs.
Even if I put it here, she can still move her wrist to brush her hair and to feed herself, and hopefully the IV pump won't go off because I'm above the joint.
Okay, now you're going to activate the ChlorPrep solution.
Okay, this ChlorPrep looks different, I think, than the one that you have in your kit. You've got a little tiny swab like for the central line. This one's in a plastic bullet. I'm not actually going to activate it because it takes a while to dry, but I would squeeze the chamber and the little cotton ball gets moist on the end. And I'm going to use the same waffle pattern as I would with any ChlorPrep. With the little swab sponge stick that you've got, those of you that drew the central line dressing change last week, you probably remember, I'm going to drip, 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 and I'm going to clean it 15 seconds one direction, and then I'm going to go back 15 seconds the other direction, and then discard this.
Then it says release the tourniquet temporarily, avoid reaching across the clean's insertion site. Allow the ChlorPrep to dry completely, no fanning or blowing.
While the core prep solution is drying, keep the twin site within your field of vision. Prepare the rest of your supplies. Prepare one piece of tape. Open the extension set tubing and remove the normal saline flush from the plastic packaging.
So I'm gonna need one piece of tubing to secure that little tail, and I clean the sides of my table, so that should be good to go. I'm gonna open up my sterile saline just like you have in your kit. I've opened up my extension set. And I'm going to take off my cap. I can discard this. And I'm not gonna clean this because it just came out of a sterile package. It's never been used before. I've just taken it out of the package, and I'm gonna screw my syringe into it. And I'm gonna have to take the cap off the other end so that I can prime my set. And I need my wastebasket. I should have moved that over before I started. I'm going to push the syringe down and prime my set. And now I'm looking at my tubing and I don't see any air in it. Now because I don't have a cap, I'm going to put that sterile end back in the little package to protect it till I'm ready for it. I can lay the syringe down on the bed because it's screwed into my end. And this is going to be one situation where you can put your supplies down in the bed because you're going to need this to grab it when the time comes. But I've got the cap, the part that doesn't have the cap on it, it's inside that sterile package to protect it.
Then you're going to reapply the tourniquet. Avoid reaching across the cleanse insertion site. Palpate the patient's radial pulse to reassure that the tourniquet is not too tight. Don a pair of clean gloves.
Okay, let me move my wastebasket down here and get into position. And I'm keeping an eye on everything. I'm making sure that with her right hand she doesn't reach over there and start scratching the site. And I need to put my tourniquet on. I want to reach around. I don't want to reach across the area that I cleaned with my ChloraPrep. So I'm going to reach around and put my tourniquet back on so my vein will pop up again, and fix it so that the tails are going this direction. They're not flopping over my site. And I need to check my pulse. That's how I know that the tourniquet's not on too tight. So I can feel her radial pulse, so I know that it's not too tight. Time to put my clean gloves on.
You're going to remove the protective tip from the IV catheter and loosen the stylet of the over-the-needle catheter.
So I'm going to open up my protective IV, and I'm going to take the cap off, discard that, and I may want to push it up just a little bit and make sure that it's not stuck. Sometimes they stick a little bit. I pushed up, it's got a little hump here on the end, a little that I can push it up with. I don't want to push it off too far, but it's not stuck. It's moving for me.
Okay, then you want to stabilize the vein below the proposed insertion site by placing thumb over vein and pulling skin against the direction of the insertion. 1 to 2 inches distal to the site. Be careful that the positioning of the thumb does not cause an increased insertion angle.
Okay, I want my bevel up, and I've got a little plastic tab here, and if I've got it with the tab facing the ceiling, that also indicates that the bevel is up too, that little plastic tab. Miss Hudson, we're about to begin, and I'll tell you there's going to be a little stick before I insert the needle, but I just wanted to warn you we're getting ready to start. And she says, okay. So I'm going to put a little traction here to straighten out the vein and to stabilize it, but I don't want to put my fingers all over where I cleaned and where I'm going to insert the needle. So I'm going to put some traction. I'm going to start at a 10 to 30 degree angle to get the needle in. Do you need to read some more, Christina? Am I putting the needle in?
Avoid contaminating the IV catheter with your stabilizing hand. Avoid placing fingers above the site. Warn patient of a sharp, quick stick Penetrate the skin at 10 to 30-degree angle with the bevel up. Observe for a brisk, dark blood return in the flashback chamber of the catheter, indicating the needle has entered the vein.
Okay, Miss Hudson, you're going to feel a little stick. Take a deep breath. I've got a 10 to 30-degree angle. I'm inserting it, and I'm seeing some flashback here in the chamber. So now I need to drop down to a 10 degree, because if I have it hoisted up in the air like that, it's going to go through the other wall of the vein. So Christina, am I ready to insert it the rest of the way from the steps?
You lowered it, advanced the catheter with the insertion lever off the stylet to thread catheter into the vein using the one-finger method or two-finger method.
So it's simultaneously, I'm pushing the little plastic hub and pulling back on the needle at the same time. All right, we heard click.
Okay, continue until the catheter hub rests at the venipuncture site. Do not reinsert stylet once the catheter has been advanced into the skin.
Okay.
Continue to hold the skin taut for this safety device by the catheter off the stylet while gliding the protective guard over the stylet. Click to lock device.
Already
Stabilize
click.
the catheter at the hub with one hand while releasing the tourniquet with the other.
Okay, so I'm holding on to the IV. Miss Hudson, it's in place, but I need you to hold still till I get it taped down. And she says, okay, I don't want to be stuck again.
Okay, apply gentle but firm pressure with the pinky finger of the non-dominant hand 1 inch above insertion site. Hold the catheter firmly at the hub with the index finger and the thumb of the non-dominant hand and remove the stylet.
Okay, so I'm using my pinky finger to dam the vein, so hopefully the blood won't run out all over the bed, and I need to attach it to this tubing here. There it is. I'm going to screw it in.
Okay, then after you screw it in, you're going to move the slide clamp towards the syringe with one hand and hold the syringe with the other hand. Be sure to leave some slack in the extension